Facial artery is the chief artery of the face. One line of introduction. Then, what about its origin? Facial artery is one of the anterior branches of external carotid artery. External carotid artery gives off three anterior branches. These are the lingual artery, the superior thyroid artery, and facial artery. So, facial artery is one of the three anterior branches of the external carotid artery. What about termination? The external carotid artery, after it gives rise to the facial artery enters the face after passing for a brief period in the submandibular region and ends in the medial angle of the eye by continuing as angular artery. So, the termination is facial artery continues as angular artery, right? Then, what about the extent? Remember, the course of the facial artery extends from the level of just above the tip of the greater corner of the hyoid bone to the medial angle of the eye. The facial artery actually arises just above the tip of the greater corner of the hyoid. That is the beginning, and that is the beginning extent, and the terminal extent is the medial angle of the eye. This is the extent. Then, what about the parts? The facial artery is divided into a cervical part which is present in the neck region and then a facial part. The cervical part, after it arises from the front of the external carotid artery above the tip of the greater corner of the hyoid bone, runs upwards to lie deep to the submandibular salivary gland. And from here it enters the face by becoming the facial part at this level. This level is described as the antero-inferior angle of the masseter. At the antero-inferior angle of the masseter, it is crossed superficially by marginal mandibular vein and it enters the face. In the face, what is its course? This is what is important for us. Cervical part, its course and relation and branches we will talk about in detail again. In the facial part, this is what you need to begin with. The facial artery enters the face at the antero-inferior angle of the masseter, and here it is crossed by the marginal mandibular branch of facial nerve. What is the importance? We will discuss. Then the artery runs a tortuous course. The artery is not running straight in the face, but instead it runs tortuously. What is the reason for this tortuosity? The facial artery runs between the muscles of the face. So, contraction and relaxation of muscles of the face can actually tear the artery if the artery is straight. In order to prevent this, the facial artery is tortuous so that it can be stretched during the contractions and relaxations of facial muscles, right? So, the facial artery, after it crosses antero-inferior angle of the masseter, runs along the side of the face where it lies about 1.25 centimeter from the angle of the mouth. This is an important relation you must remember, right? So, from here it ascends along the side of dorsum of the nose, runs on the side of the nose before it terminates in the medial angle of the eye. Close to the medial angle of the eye, it terminates as angular artery, and this angular artery will anastomose with the supratrochlear and supraorbital branches of the ophthalmic artery. This we have discussed in the chapter of scalp also. The supratrochlear artery and the supraorbital artery, they anastomose with the branches of the external carotid artery over the scalp, right? Similarly, the medial angle of the eye, angular artery, which is the continuation of facial artery, which is a branch of external carotid, is anastomosing with supratrochlear and supraorbital artery, which are branches coming from the ophthalmic artery, which is in turn a branch of the internal carotid. So, face and scalp are two important sites where you have anastomosis between the branches of internal carotid artery and external carotid artery, right? This is regarding the course and relations of the facial artery, including its parts. What about the branches? As I said, we are not discussing about the branches in the neck now, branches coming from the cervical part. Branches in the face are, it gives off an inferior labial artery. As the name suggests, this supplies the lower lip, muscles around the lower lip. Then it gives off a branch called as superior labial artery. As the name suggests, supply the muscles around the upper lip. Apart from this, it also gives off a lateral nasal branch which supply the muscles around the ala of the nose. right? So this is regarding the branches and area of distribution of the facial artery.